Thank you. And as my slides are queuing up, I wanted to sort of harness the spirit of Dr. Tony Yancey and ask you guys to just at least stretch with me. We can count down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, great. Thank you. So I am Genoveva Islas-Hooker, and I'm the director of the Central California Regional Obesity Prevention Program, long title. We call it CROP for short. I'm also in a transition period where I will soon be coordinating CTG efforts statewide, so I'm going to try to speak a little bit to that also in my presentation. And the last notable thing I should say is that I am the board chair for the Latino Coalition for a Healthy California, and so some of my comments will also reflect that perspective. So the CROP is a program that's been working in California's San Joaquin Valley. This is really the heart of California. It's 8 contiguous counties that are joined together, and we're a partnership of public health departments, community-based organizations, and grassroots community members who've been working to create healthier communities through a policy, systems, and environmental change perspective. So I want to talk to you about promotoras, and to start I'd like to just sort of explain a brief or a general definition of what promotoras are. Promotoras or community health workers are volunteer community members and sometimes paid front-time public health workers who are trusted members of and or have an unusually close understanding of the community they're serving. Promotoras generally share the ethnicity, language, socioeconomic status, and life experiences of the community members they serve. In our example of promotoras that I'll be sharing with you, we've been using promotoras as agents for change, and they have been inspiring civic engagement in the creation of healthy communities. And I should also mention that I am an advocate for putting the public back in public health. So, here's 2 of my heroes. One of them, Bill, you'll know, of course, as the former leader of the Free World, and Hema, many of you may not know, but she is a leader in the Greenfield neighborhood of Bakersfield. And she's a monolingual Spanish-speaking resident who immigrated from Mexico. Her husband works in agriculture, and Hema and the low-income women in her neighborhood have been really transforming their community. They have improved their park. They've made it safer for play. They've organized walking groups and aerobics classes in that park. They've revamped the park playground to make it safer for children to play. And they've also been instrumental in installing a walking trail. A cute story just to quickly mention there is that when they originally went to the city to say that they wanted this walking trail around the perimeter of the park, they were told, we don't have any money for that. And they asked, well, how much money would it take? And they gave them some ballpark of around $10,000. And they ended up raising that money through tamale sales and outreach to businesses in their community. And so they came back to the city and they said, here's the money, can we get our walking path? And they said, well, that was just materials, that doesn't cover labor. And they said, our husbands are in construction, just give us the permits and we'll do it. And they were successful at doing that. And that's exactly the type of potential and power that is untapped in our communities that really could be leveraged to help transform our communities and make them healthier. So people in her community don't know Bill, but they know her. She is their leader, and we need more local, everyday, ordinary leaders to do exactly what Hema and her neighbors and in Greenfield have been doing. So a little bit about the context about why that type of work is needed and important in the San Joaquin Valley. I mentioned to you that it's these 8 counties in the center of California, and these 8 counties really represent the agricultural powerhouse of California. The Central Valley, unfortunately, is an area of a lot of extraction and not enough investment. There's really a maldistribution of resources that happens there. It is, as I've mentioned, the fruit and vegetable bowl of California, and many would argue the world, or our nation certainly. But because of our economy, it also has the largest concentration of farm laborers in California, most of whom are Latino and most of whom live below the federal poverty level. One tangent to mention is that behind agriculture, the leading industries in the Central Valley are prisons. We have the highest prison to population ratio in the state of California. And right behind prisons, we have the highest development of dialysis centers in the state of California also. So many people would call it ironic that these same farm workers who pick our fruits and vegetables oftentimes do not have the same healthy food on their table. I call it a shame. I call it inequity in its purest sense. And this is a wrong that you and I can't fix alone. We need everyday leaders and residents to stand up to address this inequity. And I wanted to do a little bit of an exercise to really help you come to the Central Valley in a sense. And so you don't have to close your eyes. But imagine, being in the valley and in this vast expanse of open space and agricultural land and wanting to take a deep breath. And you breathe and you take in this breath, and it has particulate matter and it has pesticides in it, and it's predisposing you to asthma and a lot of other health hazards. And as you're breathing, you're coughing because the Central Valley has the highest also pollutant, poor air quality in our nation, some of the communities there. And as you're coughing and you want to stop coughing and you want to get a drink of water, you can't, because that water is also contaminated by the arsenic that is put there by the agricultural industry and other naturally occurring sources. So you're low income and you want to drink because you're thirsty, and you'll find that water is more expensive than purchasing sugary sweetened beverages. And so you will end up purchasing sugar sweetened beverages on a regular basis because that's what you can afford for yourself and for your family. And so what's being created obviously is this cycle of conspiring factors that are really working against people's ability to eat healthy and practice healthy lifestyles. And it is those conspiring factors that were first introduced to me by the IOM when we began this work 7 years ago. And it's really drilled home for me, and unfortunately, we haven't eliminated all of those conspiring factors. So we really need to continue to have this focus on creating healthier communities, and certainly access to care is a component of that. But we need to think also outside of that, and so that's the beauty of working with community residents. So ensuring access to healthy foods and safe places to play are fundamental assets to promote healthy behaviors and prevent disease, and we need residents galvanized to help achieve this. Why? Because in the Valley, 1 in 3 children are overweight and obese, and this is in a region of abundance. Why? Because in California, half of all Latino children born since 2010 will develop diabetes in their lifetime. Half. So 1 of these 2 lovely children will develop diabetes. And that's unacceptable. But also when we think about the opportunities that are going to be afforded in terms of new people entering into healthcare, will this this person be someone whose family is lucky to be insured or not? And I think for me, the compelling thing behind that is that when we create healthy communities and we offer more opportunities for prevention, that's a benefit that we all have, right? That healthy community benefits everyone, and that's why, again, this focus should continue to be on creating whole communities and healthy communities. We were funded by the Robert Wood Johnson Foundation to develop this curriculum on leadership development, which is the curriculum that we've used to engage residents to be the promotoras and agents for change in their community, and that was completed this year. And what we've been teaching them or engaging them in is in this cycle of advocacy, identifying a problem, gathering information, setting objectives, sort of the public health model, but in a simplified, sort of digested way for residents to really be able to participate and engage in that. And this model requires allies. These are very vulnerable residents, and that's why it's important to have the healthcare community in line and supporting their residents, as well as the public health departments and other community-based organizations. So we targeted low-income residents who traditionally don't get involved in public decision-making. They came from a mix of rural towns, unincorporated communities, and urban neighborhoods. Many, of course, were farm laborers. And they got involved because they cared about their community and they wanted a better place for their children. That's the first cohort, and this is the second cohort. And what they've done, as I've mentioned, has been phenomenal. You know, they have, in their own local way, made changes that have allowed for more physical activity in their neighborhoods and their communities. They've unlocked school gates in neighborhoods that did not have safe places to play. They improved their parks to promote physical activity. They've organized walking school buses. They've also done a number of interventions that have really made access to healthy foods more accessible to them. So they've set up school farm stands in neighborhoods that were food deserts. They've brought fruits and vegetables into their local markets, small stores as well. So the point to underscore here is that they identified their issues, they moved their solutions into action, and they raised their voices and they led, right? And this is what we need more of in our communities. So the next slide. So this is one of the leaders, and she's saying for me in the future it will be very important because I can make changes in my community, changes in my family, and I hope that we can make changes at a statewide level. And wouldn't it be phenomenal that everybody felt empowered and capable of doing that in their own settings? I did bring a video that I wanted to show at this point to allow you to hear from some of the community residents directly, and just to set up this video as it's being cued. This is a video of a school farm stand in the Fresno Burroughs neighborhood, and this was an area that did not have good access to healthy foods or public transportation opportunities to take people to where those healthy foods were. So what we did was the parents working with their school began to advocate for this idea of, can we establish a school farm stand so that neighbors around the school and residents and youth could begin to avail themselves to the healthy produce. And they also, I don't think that's the right one. That one should be it. I'm sorry, I'm trying to see how this works. Okay, so this model was successful and it has been replicated in other school settings.
The Central California Regional Obesity Prevention Program is a program of the Public Health Institute. This valuable work is made possible through support from the California Endowment and the Robert Wood Johnson Foundation.
What better way to improve access to healthy food for children and their parents by bringing healthy fruits and vegetables to their neighborhood school? This is a school farm stand. It's operated in Burroughs Elementary School in Fresno.
I get out here once a week and set that thing up, and there's always a line of people. So it's working out well.
The school farm stand started here at Burroughs back in 2008 through the efforts of parents and the Central California Regional Obesity Prevention Program.
In working with the community, we discovered that the community really didn't have access to fresh fruits and vegetables. And the community really needed that access, that convenience. So we decided that, and the community decided that it was very important for them to have something that was not only accessible, but affordable as well.
It's a mission that is very important to Brooke Crabtree. He is the director of the School Farm Stand for Farmers Produce. Farmers Produce was created to bring school farm stands to life, making fresh, locally grown produce available for the Valley's families.
It's a lot of fun. We get to work with children to parents to teachers to facilitators. It's every day something special happens out here, whether you're helping an 8-year-old child feed their family, which you get to see them yourself, buy green beans and garlic and onions instead of bananas and apples and things like that. It's amazing. Sometimes it's heart-wrenching, but most of the time it brings big smiles to our faces, and that's what makes it work. The whole purpose here is to change the way groceries are sold here in the Valley. We've gotten away from the farm, which is sad. We live in an ocean of agriculture, and yet the average meal travels 1,500 miles to get to your and my plate.
California is the largest exporter of agricultural products in the nation, but yet we frequently have communities left deserted of fresh produce. CROP's goal is to ensure that communities have access to nutritious options.
And we want to expose the children to healthier eating, and that's really what we're all about. We want to prevent obesity. We want to bring healthier alternatives to communities that do not have those alternatives. Oftentimes what we see are communities that are bombarded with a lot of fast food outlets, and we want to change those environments. We want to bring healthier options, and we want that healthy option to be the easiest choice for families.
This school farm stand at Burroughs Elementary has opened up a whole new world to 6th grader Ernesto Castro.
Now I like zucchini, broccoli, relish, asparagus. The new fruits I like are pineapples, guava, star fruit, and that's all the fruits I've tried now. I don't see the fruit, I mostly just try to taste it in my mouth.
Ernesto's father volunteers with Burroughs School Farm Stand as its manager of operations. It's a big job, but he's feeling the benefit not only for his community, but for his family and himself.
It's a lot of hard work. You got to be committed because, you know, some days it's too cold, some days it's raining, the wind. I mean, it's a lot of things. So, and I really enjoy it. It's worked out for me because at the same time I've learned how to eat better. I'm diabetic, by the way, so the diabetes has gone down a lot. I wanted to get rid of it, but it's, you know, it's improving. My cholesterol is down. I lost a few pounds. You can't really tell, but I have. And I want to show my son better eating habits, so he doesn't get diabetes when he gets my age, you know. So, because my dad's got it too, so it runs in the family.
The school farm stand is a practical solution to a complex problem, bringing benefits that extend beyond these campus gates. The farm stand model continues to evolve and has taken on a different look in communities throughout the San Joaquin Valley.
The community has really embraced this project very well. The children love it. The children actually feel like they have that option, that healthy option. And it really ties very well with the school wellness policy as a way of engaging not only the youth, but also parents.
You can stop it.
Here are some things you can do to help improve
Thank you. So a little bit of the backstory behind that was that meeting with the parents there in the Burroughs neighborhood, they were very interested in bringing a farmer's market originally. And what we learned in that time was that Fresno had a zoning ordinance that actually prohibited the establishment of farmers markets. So we spent a lot of concentrated effort to try to get that zoning ordinance changed, and we did. We were successful. But then when we went to trying to establish the farmers market, there was this very large conditional use permit that was really outside of the affordability of us to be able to establish the farmers market. And in this convening of parents with school and public health department, someone suggested, what about doing the school farm stand at the school campus, and that the school really had autonomy over what they would allow to be established there. And it really felt something that they could do without the permission of the city because of their autonomy over their campus. And so that's why this became a successful model, because there wasn't this huge conditional use permit that had to be paid in order to get the school farm stand up and going. And then it was just a matter of connecting a local farmer who was willing to source to that school farm stand. And like I've said, they've generally operated during the summer months, but they've been a fantastic way to both talk about wellness, get kids access to that produce, and then provide a venue for the surrounding community to avail to healthy foods as well. So this is Hema again, and you've seen her now with two notables, and Arnold really contributes nothing to the story, but I just liked having another picture of Hema with a notable to really show you how, you know, again, a very ordinary, everyday person has been making connections and being an advocate for her community. And she met Arnold and Maria at an obesity summit that was convened by the California Endowment. And so she was able to continue sort of her advocacy around what needs to happen in more communities like hers. Hema is, I should mention, a steering committee member now for California Convergence. She's also on the advisory committee for the local BHC work, the Building Healthy Communities work that's happening in her and around her neighborhood. And this has been a byproduct of some of our work in terms of more of these residents who have gone through leadership training and have been promotoras are now assuming leadership seats. And I think about the success and wins that we've had as a result of that, and they've included things like having one of our residents become a school board member in Tulare County in the community of Early Mart. And because she was there, she was able to influence the adoption of a school wellness policy that actually eliminated flavored milk and sugar-sweetened beverages completely from their menu. And I have to tell you that this is in a county that has more cows than people, and changing a school wellness policy to eliminate flavored milk was a huge step in the right direction. But that's sort of the benefit I think that we can reap when, again, community residents who are passionate about health and well-being become leaders in this effort with us. And similarly, we have had a number of members who have become members of school wellness committees, and they have helped to champion and push things like joint use agreements, unlocking more school gates in places that were very hesitant to do that because of what they perceived as liability issues if they were to do that. So with resident leadership, we've definitely been able to increase access to healthy foods for children, increase opportunities for safe places to play. And unfortunately, what we risk in absence of engaging them more is this status quo. Communities where children don't have safe routes to school, and communities that only provide access to very cheap, unhealthy food. And so we need to continue to work to change that. Thank you for allowing me to share a little bit about our project with you. And I guess just my closing remark in terms of the power of this project and the beauty of it is that it is a legacy that is not going to sunset with any particular program funding, that this capacity building and engagement of grassroots community members is very lasting, and they are very passionate about the work that they're doing, and it's very relevant to them. And again, I think we need to connect more and support more of those efforts wherever we can. And lastly, just a point on the urgency. I've had several family members who have died because of preventable illnesses, and many of the residents that we work with talk about very similar stories. And the sense of urgency that they convey and they bring to this is immensely important as well. And I value all the need for planning and really being strategic about our efforts, but unless you have that passion and that commitment to really change things, you lose, I think, a sense of urgency that is very, very important. And so I just want to, for them, underscore that we really need to be courageous about advancing this work and really being committed to make change in our communities. So thank you.
Thank you, Veva, for sharing a little bit of your story and for such an inspiring presentation. Our next speaker is Jim Hester. Jim is the former director of the Population Health Models Group at the Innovation Center at CMS, is currently working as an independent consultant in Vermont.